Eating disorder is any range of psychological disorder characterized by abnormal or disturbed eating habits, complex mental health conditions that often require intervention of medical and psychological experts to alter their course of treatment.
There are 6 types of eating disorders: anorexia nervosa, bulimia nervosa, binge eating disorder, pica, rumination disorder, avoidance/restrictive food intake disorder, or some other eating disorders that are less known, like purging disorder, night eating disorder, or other specified feeding or eating disorders, otherwise known as offset.
Symptoms include fixating your body weight and shape, basing your self esteem on weight or body shape, being hypocritical of perceived physical imperfections, dramatically changing what you eat and the way you eat, such as restricting what you eat or binging and then purging after you eat, or eating enormous quantities of food and not purging, experiencing a lack of control over problematic eating behaviors, avoiding the severity of the situation, such as making light of or becoming defensive when confronted by others on your eating patterns, feeling shame and guilt about your eating habits, or being addicted to food such that you feel uncontrollable cravings for certain foods, such as sugar, and being unable to control your intake of those foods.
What causes them? Hereditary, personality traits, perceived in society pressures, and differences in brain structure and biology.
Unlike most mental disorders that can be treated successfully by medicine, eating disorders are a bit more complicated and haven't been as responsive to medication. Mood stabilizers, antidepressants, and antipsychotics have been used for some patients that have contracted other underlying medical illnesses along with the eating disorder. There are only 2 FDA-approved medications for treating eating disorders. It's fluoxetine and for bulimia nervosa and lisdexamfetamine for binge eating disorder.
What to expect from treatment? Most people, when seeking treatment, go to an inpatient or outpatient program. Whichever one you are recommended to attend depends on the severity of your disorder and your physical and mental stability. Inpatient programs are necessary for patients with long-lasting disorders, those that are at self-harm risk, and those with substance abuse along with their ED. Standard outpatient treatments have more patients and are require less supervision, though any treatment will be overseen by doctors and therapists specifically trained for treating eating disorders. Most center around foundations to treat anorexia and bulimia rely on behavioral therapy and peer support. Peer support techniques include bringing people together with the similar symptoms and same disorders to talk freely about your experiences in hopes to help release the feeling of loneliness that can lead to suicidal thoughts and actions. You can learn coping techniques, how to provide encouragement, and how to mentally process the treatment. These groups are often the core of residential treatment communities. There are also family behavioral therapy by professional counselors incorporated to work through the underlying emotional issues of the disorders.
Why is it important to us specifically? Western ideas have targeted young females through magazines and social media to give us the idea of the perfect body type. These magazines that emphasize the Western ideas of body types are more presented to women, which fills the women brain with more pressure to be perfect versus men. Eating disorders are proven to be more prevalent in women than men. 95% of diagnosed with anorexia are women, 80% of diagnosed with bulimia are women, and 50% of diagnosed with binge eating disorder are women. 95% of all eating disorder cases in people ages from 12 to 25. Among adolescent girls, eating disorders are 1/3 of the most common chronic illnesses.
Myths of eating disorders. There are many myths and stereotypes conjugated about eating disorders from family, friends, and the general public. The first one is that all people with ED are underweight. Eating disorders only affect women. Eating disorders are caused by celebrities' image in the media. Eating disorders only affect young people, and eating disorders is made up of a concept of attention-seeking people. All myths.
The importance of nutrition. Eating disorders have the second highest mortality rate of all mental illnesses, only behind substance abuse. The underconsumption of nutrients can result in malnutrition, lack of motivation, and in serious cases, death. Having a healthy relationship with food benefits a person's mind and body. This can also balance out mental health as well. Creating a routine of eating 3 meals a day or eating in moderation, depending on the disorder, can benefit someone's life.
Catholicism's teachings on eating disorder. It revolves around theology of the body, where it is person-centered has always been a big concept of Catholicism. The body of the human person is a surpassing gift which must be received as a gift from God, a gift which must be respected with reverence. Theology of the body has a long history and a rich tradition in the Church. Early fathers and doctors of the Church wrote about the body and its relation to the soul, created by God in his image and destined for bodily resurrection. Catholicism theologians and philosophers have written more recently comparing the human dignity to the meaning of the human body and the concepts of morality, marriage, and vocation to love and thyself.
Why is it still relevant? Eating disorders have the highest mortality rate of any mental illness because of its effect on a person's mental and physical health. Awareness is important because right now getting help for the eating disorder takes around 2 years on average for someone with anorexia. With research suggesting at least 1 in 20 people will experience an eating disorder in their lifetime, such delays can not only result in the illness becoming more difficult to treat, but they also have a significant cost to life.